Sunshine's Corner, being brought to you by Quint and Richie Studer. And a beautiful Thursday morning it is. Good morning, ladies and gentlemen. How are you? Welcome into the hottest spot in town, that is Sunshine's Corner. Here, you know, we talk about the things that are important to the community, the things that makes a difference. And I always, every single day, ask that you be a part of the conversation. Why? Because I believe once we put all of our resources together, if we can talk about something, we can come up with a better solution. And that's the way it is right here at Sunshine's Corner. We are your community information network, so you know what you got to do. Tell somebody when you want to know what's happening, what's going on in and around our community. This is the place that you need to be. And each and every single day, you know, I reach out to try to have guests to talk about things that are important to us, the things that affect us right here, and ways that we can also better ourselves in things that we think that we've gotten to the top. When we see there's another part that we can go higher, get better, and get better. And today it is no different. Listen at this. You've heard me talk about Civicon. You've heard me talk about all of the things that Quint Studer has done with that organization, with this, the SCI. It is absolutely amazing, some of the people that I've had the opportunity to have on the show with me, and today is no different. I have a young man that's on with me today, and as a matter of fact, he's a recipient of one of those awards that's centered around Civicon. And I want to say good morning and welcome there, Walter, in with me today so we can have a great conversation.
Oh, thank you for having me, Sunshine. I appreciate it.
No doubt about it. Now, Walter Arrington,
Yes, ma'am.
You are there with Community Health.
Yes, ma'am.
And let's talk a little bit about that so we can ease on up to where I want to get to how you got this great big award that you received. Okay, tell us about Community Health.
So, Community Health Northwest Florida, we are what's called a federally qualified healthcare center. So that means that we provide care to our community regardless of ability to pay or insurance status. We don't turn away anybody. And then we really focus in on providing holistic care. So whether it be pediatric, adult, pharmacy, radiological, behavioral health care, therapy services, GYN care. We like to say that we do it all, and if we don't, we can get you connected with somebody who can.
Really? You even said therapy?
Yes, ma'am.
Oh, wonderful.
Yes, ma'am.
Everybody needs to talk to somebody sometimes.
Yeah.
You know?
Oh, yeah. Well, and that's my profession. I'm a social worker.
Okay.
So I'm in the process to get my full license as a therapist, but that's my jam, so to speak.
All right, jams go with that. Jams go with the peanut butter.
Yeah.
That's my little sandwich joke, okay?
Yeah.
But I tell you though, Walter, it is so nice to hear that with Community Health, they provide so many things for the community. And there's yet a lot of people that's not aware of everything that you do provide. Now, you went through a host of other things that you take care of, but I want to see how hard is it for a person. What do they have to do? Let's say if they have something that's going on with a child. They need to get in touch with you. What do they need to do?
So especially with a child, we wake up sometimes. I've got a 13-year-old. You wake up and they've got a runny nose. So we have a walk-in clinic. We call it our 12th App Peds walk-in. It's over close to Ascension Sacred Heart. We also have another clinic on 12th Avenue. And so you can call any one of our locations.
Really?
Just Google us and we can get you in same day. We also have our adult walk-in clinic at 1400 Palafox. It was voted by In Weekly as one of the top walk-in clinics in town.
Of course.
And honestly, if you've never been seen by us, sometimes that's the easiest way. Just come to our walk-in clinic, get that need taken care of, and we can get you scheduled with a primary care provider to meet your continued needs going forward.
That was my next question. Do they have to have a primary care? So you work that out with a person who does not have one?
Correct. Yeah, absolutely. So, and if you say, oh, I'm not sick right now, I just need to get established, you can call our main number. Just Google us, Community Health Northwest Florida, that first number that pops up. Call it, we'll answer your call and get you scheduled. And again, we have primary care providers that are representative of our community.
Right.
So if you have a preference where you want to see somebody who's a male presenting or femme presenting or a person of color, somebody who speaks Spanish,
really?
We've got that at Community Health. Across multiple service lines, whether it be GYN care for reproductive health care, whether it be for therapy services or psychiatric care.
Oh my God, you cover everything.
Yes, ma'am.
But that's what I'm saying that's so important. See, I'm being educated today as well. Now, I've heard of Community Health. Have not been there. I've heard of it, but I'm finding out even more of what you offer that's so beneficial for the community. Now, let's say if a person get up today and, my stomach hurts so bad and I just don't know what's wrong with me. And if they come to, I heard you say there's one for children and one for adults. Mm-hmm. So the one that's on Palafox, that would be the one for the adults, right?
Correct, and in some cases too, we can see children there as well. We always say we want to see you get care. The last thing we want people to do is go sit in an emergency room, waiting room for 8 hours.
Oh, God.
And then too,
and you got to pay $15,000.
I'm telling you. and here's the thing: if you get to see us and that provider goes, you got some serious stuff going on, we'll get you to that higher level of care. And again, that walk-in clinic, it's got x-rays on site. It's got lab services on site. We've got a pharmacy on site there. You get to go see Ms. Nettie at the pharmacy, get your meds before you walk out that door.
Are you serious?
Yes, ma'am.
Now, I did not know that. So everything is under the roof. You don't have to go run over town to get that.
No.
That's great.
And then we can even get you set up. We're kind of unique in our pharmacies. We've got delivery services. So even if you don't receive care from us, if you say, I don't like going to the pharmacy every month, you call up our pharmacies, get your meds transferred in, and we'll get you set up on a no-cost delivery for our insured patients, where they will bring your medication to your door. If you've got a copay, they'll collect that copay. Mr. George will set up the time, call you ahead of time, let you know what's coming, and you're taken care of.
You are blowing me away. I mean, this is, ladies and gentlemen, did you know all these services were provided for us? I didn't. I mean, the fact of it is, and I think now because with the economy how it is, a lot of people are having difficulties. And I don't know how to word this, but I don't want people to feel embarrassed if they're having a difficulty when there are places that can give the help that they need, because we all go through things at some time or another in our lives, and this is the way that you can help, because you can make sure you got to take care of your health.
Yeah.
And the fact of it is that you even deliver for something that's great for the elderly.
Absolutely, and that's, we've got a gerontology clinic for our elderly. Dr. Smith, George Smith heads that up at Jackson Street. And one of the things, the misnomers with us is, we're not a healthcare clinic for people who are just uninsured or struggling. We serve everybody. When you walk into our clinics, it looks just like any other health office you would walk into. It's not run down. It's not, I feel like sometimes we can have these ideas of like it looks a certain way, like an old school health department.
Of course.
It's not that. We serve everybody. And so even if you are struggling, the person sitting next to you is not going to know that. And
That's right. Nobody has to know.
We treat people no different.
I mean, that's great, because, some people have this thing, because with me, if that was me, I wouldn't care. Okay, I need help. You know what I'm saying? You have not because you ask not.
Yeah, exactly.
And the fact of it is that with the service that you offer, I love the fact that when you said that, look, when you walk in, you're not walking into one of those places that look like you walking into a clinic where everybody there has nothing, because everybody there's service. You could have the biggest insurance ever, but you can still come there because you're going to get the right kind of service that you need. I see why you got that award. Now, you brought something here. What is that right there? I want to see what that is.
So I've got our core flyers.
Nosy.
Yeah. I'll see if I can prop one up here. So this is core, and I'll let you flip one over here.
Thank you.
It's got my my work cell on it, and it's also got some information for everybody in this community. And I feel comfortable saying everybody knows someone or has a family member that has struggled with substance use disorder.
Right.
And especially fentanyl and opiates is ravaging our communities right now. We had the crack epidemic in the 80s. We have opiates today. And so we've learned from that and how to address it more equitably in our community. We really didn't address that epidemic in the 80s because it affected a certain community.
Exactly.
Now we've realized those errors and we're addressing it to everybody. So CORE specifically, it's an innovative program in partnership with Escambia EMS. So let's say you got a cousin who is struggling with fentanyl, and he's withdrawn, he's shaken, pick up the phone, call 477-HELP, 24 hours a day. That's going to connect them with a nurse team from Escambia EMS. They're going to go through some questions, and they will come out to wherever you're at in Escambia County. They will do an assessment, and they will start you on Suboxone, which is a medication that helps address the withdrawal symptoms of opiate use disorder and helps people get sober. And it's a newer medication. It's paired with buprenorphine with naloxone, which is the same medication that reverses overdoses.
Really?
And then within usually 7 to 10 days, after EMS comes out daily and makes sure that they get their medication, builds that relationship,
Right.
they'll transfer either to us at Community Health or the Lakeview Stop program, depending on where the patient wants to go. And we maintain that care.
The patient can make a choice?
They can make a choice. Of course, we'd love them all to come to Community Health.
Exactly.
You know, but we're also, you know, it's the patient's in charge. I always say, you know, I work within CORE and I'm also a peer support specialist, which is a fancy way of saying been there, done that, got the t-shirt, okay?
You got my line. I'm laughing because I always say that. I've been there, done that, I got the t-shirt, Joe.
Yeah, you know, I mean, I've been down to the barrels and I've been down to the alphabets back in the day.
Right.
You know, walked through Pensacola Village at 2 o'clock in the morning.
Exactly.
I've done it.
Right.
But, and that's an important aspect because I can sit across from people and our staff at Community Health and we can empathize. And our perspective is, for so long, when we had family members or people that we knew struggling with substance use, everybody shook a finger at them and told them what they needed to do. That's not our approach. Our approach is, we're going to lay out the buffet and we're going to carry your plate at the buffet. You tell us what you want on that plate and it's your job to eat it. Our job is not to tell you what to eat. We're just going to support you through therapy services, through primary care, through if you got Hep C or you know maybe
what Hep C is?
Hepatitis C.
Okay, I'm getting all these medical terms.
Sorry,
right?
yeah.
I wanted to just know. Okay, Hep C, I got it. All right.
Hepatitis C, you know, or any medical needs, high blood pressure. We're going to put all those resources in. We're going to assign you a social worker, a case manager. You're going to have an assigned therapist that you can come meet with and go through therapy. You know, Sean Ryan and Keisha Tran are our 2 providers that take care of that population. Wow. And so it's really a holistic, patient-centered model of care.
Right.
And what makes it so innovative is leveraging in emergency medical services that comes to the person. So I always tell people too, EMS is not the police. We are not the police.
That's right.
You know, this is not punitive. We just want to help.
You know, I can see the passion when we speak of, I mean, the passion that you have about this, because it is really prevalent in our communities. And I didn't say community, I said communities everywhere. And I with this, and every time I hear the word fentanyl, it causes me to quiver. I did not realize, because I know that it is some parts that I don't understand how it works, but I know I had Delarian on with me one day, and he was telling how if stuff is so potent, if you have so much lying there in front, it can take you out. I mean, but how do they control that with, if a person got it? I mean, how do they know how to make it right?
Well, and that's what's so scary about it, and it's in everything. You know, fentanyl. You could be buying you know, a sack of weed off the street, and there could be fentanyl in it. We had a case not too long ago where somebody was hitting a blunt, and it had fentanyl in it, and they overdosed. We see that all the time. Amphetamines. You think you're getting a Percocet? It's got fentanyl in it. It's not real Percocet. And so, and it's mixed in somebody's kitchen. They're taking a coffee grinder and they're taking one spoonful here, and they're putting the you know the baby laxative in, and they're cutting it down. And so you could end up with what's called a hot batch, where you've got just a little bit too much in that little bag.
That's called a hot batch?
Hot batch. And you're overdosed. And you know, we see it, I think, around, in the last 5 years, EMS has run over 15,000 overdose calls.
Oh my Jesus, 15,000? So this stuff is taken, so you see I'm stammering for words because of the number. Each time I talk to somebody, I learn something different about it, because it's so prevalent in the communities now. And it's such a killer. When I say that, it's taking them out. Because I guess it's a high. Got to be a high, something that makes you feel good.
Yeah, and initially, and we can take it all the way back. You know, we had years ago, we had the pill mills, and we had people who had legitimate.
We had the what?
Pill mills.
Okay.
The doctors that were prescribing the medications and kind of.
I'm learning.
Yeah, I think we had a case over in Gulf Breeze not too long ago where we had a doctor that was arrested for over.
I saw that.
Yeah, that's pill mill activities.
Get out.
Yep, and so it gets, people have legitimate pain issues, they have legitimate injuries, but because of some of the information, and again, we know science evolves, things change, and then we had bad actors that overprescribed the medication, and so there crosses a line where there's the physical addiction. You know, opiates, the way they work in our brain, they develop a physical addiction even if somebody's taking their medication as prescribed, as the doctor orders. Yeah. And so then that medication goes away. They don't want to get high. They just don't want to feel bad because the withdrawal symptoms are so just life-changing. I mean, imagine having the worst flu or the worst case of COVID ever if you didn't take this specific medication or this specific drug. And so what Suboxone does is that it bonds to those opiate receptors. It's what's called a partial agonist. So it turns that light switch halfway on, those opiate receptors. It addresses the withdrawal symptoms, and then the naloxone counteracts those feelings of euphoria that come along with taking of opiates. And so the medication's literally just addressing the withdrawal symptoms. People aren't getting high. They're healing. They're getting better. And so this program, we get people in, we address the withdrawal symptoms, we stabilize them, we address those social drivers of health. Make sure, you know, they've got housing, that they've got good employment, that they can support themselves, that their medical needs, and then we, over time, you know, we call what's called titrate, take them down slowly off of the medication. And some people, if they've got chronic pain, they may be on it the rest of their lives, and that's okay, because it's a lot better than popping a pill.
Amen. Amen. Everybody, we are talking about Mr. Walter Arrington. He's from Community Health Services. Believe me, I'm finding out a lot that Community Health Service offer. And if you are as amazed as I am, I'm stammering. I don't do that. Make sure you be a part of this conversation. If you've got questions, perhaps you've got someone that you're not sure. Maybe there's something that you can find out that he can help you to determine if that's going on. Call us up at 850-432-7768, or you can text as well. Right here, Sunshine's Corner. We'll be back with more.
Good day, Pensacola. Welcome to a new segment on health and wellness sponsored by Baptist Healthcare in partnership with Sunshine's Corner. Every first Wednesday of the month during Sunshine's telecast, we're going to be bringing you information about health and wellness and ways to make sure we're improving the quality of your health care here in Pensacola. After all, we want to ensure that you're going to the right place at the right time and for the right reason, and that you don't feel alone. Can't wait to see you.
Empire Truck Sales, located at 2255 West Detroit Boulevard in Pensacola, is your Freightliner, Western Star, Detroit Diesel, and Cummins dealer for Northwest Florida. Open 7 days a week, Monday through Friday, 6 a.m. to 10 p.m., Saturdays and Sundays, 6 a.m. to 6 p.m., providing sales, service, and parts. Empire Truck Sales is also your Oasis dealer for Freightliner custom chassis RV and motorhome repairs. Running I-10 will get you in.
Many who consider facial plastic surgery are concerned their results will look unnatural. But with over 20 years of serving the Pensacola community, his thousands of satisfied patients have made Dr. Derek Jones a trusted reconstructive and facial plastic surgeon known for industry-leading results that look natural. Call 850-484-FACE to schedule a consultation at one of our locations in Pensacola and Gulf Breeze.
I'm Dr. Derek Jones. Trust your face to a facial plastic surgeon.
At Pensacola Habitat for Humanity, we believe every child should have a safe place to grow. That's why we work with you and the community to build not just a house, but a home.
She worked very hard to get this house. I really appreciate that because, if it wasn't for her, I wouldn't be here right now.
When you help build a home, you build a future. Pensacola Habitat for Humanity.
And welcome back to Sunshine's Corner. Walter and I having such a great conversation off camera. I mean, I'm being educated. We're going to be best buds by the time we're done. But Walter, we were talking about the fact that what community health offers, and even the fact that even with the thing how you all go through the part where people with what is so prevalent in our community now, with the drugs and how they are, and to know that community health is there to offer help. Did you know that, ladies and gentlemen? Did you know that they go this deep into helping the families who need the help? This is important for us. So if you didn't know, there's going to be a number that's going to pop up on the screen where you'll be able to call community health to find out how you can get, even if you want to go there for your health services. They've got it for you. But we were talking about the fact that all the things that community health offers, and I'm finding out it's a whole lot that you all do offer, and the fact that being in social work, it's so much that you all have to deal with that you do, that we don't even have an inkling of an idea that you're dealing with on a daily basis to make the community better. That's what we were talking about, how we can come together to make it better with the things that are going on with what you do. And you were saying, now we were talking about core, but there's something else you said, another.
Yeah, so so the model of care at Community Health, and kind of our mission is healthcare for everybody, equitable healthcare, which means, in equity, sometimes other groups have to get lifted up more than others.
Right.
And another big area that we have in our community is infant mortality and infant health and mother and baby health. And that even interlaces with the core program.
Okay.
I always like to say we've had, 2 core babies, 2 moms that came in that were pregnant, that were struggling, and got them into care, had healthy babies, and that was another initiative that's come out recently that we've started called our Baby Bucks program.
Call it what?
Baby Bucks.
Baby Bucks, I like that.
Baby Bucks. And so the principle of Baby Bucks is we know through the research and the data that Escambia County unfortunately has high infant mortality rates and high mother mortality rates in giving birth, and there's a disconnect between access to medical care. And so we developed a Baby Buck passport. And so when mom comes in when she's pregnant, she gets little stamps in that passport. And once she gets so many stamps, she's able to go shopping at no cost and get things like strollers, car seats, pack and plays, baby clothes, all of those things to support baby once she has that healthy child. And so again, it's using incentives to make sure that mom and baby are getting that prenatal care that's so vital. But really it's about providing better health outcomes for mom and baby to drive down that mortality rate. We know that it disproportionately affects communities of color.
Of course.
We know that it disproportionately affects people living in poverty. And so how can we support the community to be a healthier community? And so that Baby Bucks program's going on right now. I was talking with Reggie just the other day, and we were ordering more. We're like, man, we're running out of stuff. We got so many people, which is a good thing.
Exactly.
We want to run out of these incentives. We want these mothers to come in and get that prenatal care with no judgment, no shame, and even if you're struggling, even if things are a struggle and you're concerned, we don't talk to anybody else. I always say I'm not one of those type of social workers.
I hear you.
No shade to DCF. They do a poor,
that's
but
right.
That's not me.
That's right.
You know what I mean?
I understand totally.
I want to help mom and baby.
That's
I
right.
want to support you and support that patient to be the most successful person they can be. And sometimes, most of the times, in fact, that's me keeping my mouth shut, that's listening, and that's supporting them in ways that they need the most, because ultimately the expert on care is the individual.
Absolutely.
I'm not the expert.
Oh, I love that.
They know what they need the most.
Most certainly. Wow, we are really being educated. There's so many social workers out that do so many things, and I didn't realize it goes so deep. And really, with community health, I got to do this. I applaud everything that you're doing, because even with the baby bucket?
Baby bucks.
Okay,
baby bucket, baby bucks. Bucks like dollars, because they get the $12, they get what they want.
I mean, but the fact that you could even give them things that's funny. I made a joke, but I mean, but the fact of it is, you even provide them with monies to go buy the things that they need. I mean, and it's not something that's going to be spent just out there thrown away. It's for the need of that mother. All of this provided through community health. I see why you got that award. I understand. And let's congratulate him, because you won the Equity Award, right?
Yes, ma'am.
There with Civicon. Tell us about what was the qualification, everything that it took to get that. You've already told me already, though.
Well, I mean, so my passions and the reason I became a social worker is I had my own desert. I came out of the Marine Corps in 2011, and I was broken.
Right.
Ended up spending 4.5 years on the streets,
right.
Homeless, 2 of it here in Pensacola.
Okay.
I've been that person flying a sign on Palafox asking for change.
Okay.
And social worker helped me. So when I started handling some of my struggles and started getting on my feet, I went back to school, and I just threw myself into volunteering with our community. I interned with Mike Kimbrell up at the Alfred Washburn Center, worked for Vinnie Wibbs up at REAP for a little while. And then I happened to meet Chandra Smiley and Jules, the chief of advocacy at Ascension, and didn't know who they were. And they said, man, you really know this unhoused population. You know the players. And
exactly.
They created a position for me to work full time with our homeless population at Community Health. And, I just continue to get involved. Was it James Baldwin, the world is held together by the love and passions of very few people.
Right.
It's my passion that drives me. And so anytime I see inequity, anytime I see a need, if I have the availability, if I have the means, I just try to help, because it was somebody who sat across from me and saw the humanity in me, in my lowest, and held space for that, or I wouldn't be here today.
Absolutely.
And so it's that's what drives me.
I mean, that is beautiful, because I when you say been there, done that, got the T-shirt, I understand totally what you mean. There are so many things that what I'm so pleased to say to you to your face, what you did turn your whole life around. And now you're giving back to the same struggle that maybe you had to help somebody else. Here is the example right here. Here is the picture right here that change is necessary. It may not feel good, but it's necessary. And look at the outcome. And now you're here, community health, psychologist gonna be helping everybody else. I mean,
social worker.
I mean, but you understand what I'm saying.
Yeah.
Because everything that I bring up is right there. You come out with it, and when we started talking about that, when I told you I could see the passion, now I understand. But that's a great thing, because I think a person can't deliver unless they know something about it. Now, you can talk about a certain thing, but if you have not walked that down that road, you can't give me the passion that I see, because you've taken those steps. And that's a good thing. And I say that to everybody. There are times when things that you go through, and I believe my God will allow us to go through things, because he got a bigger plan for us down the road. You know what I'm saying? And look what he did. I mean, look at your life today and how you're helping others. And I just want to say, let's give him the drum roll for that community, that award that he won there at Civicon. Yay! Congratulations, congratulations, congratulations. And I want to say to Quint Studer for coming up with those ideas to put these plans together so that we can make our community better. And then when you said even about the ones that you helped that's on the street, the one that's on the street, that's sleeping on the street, I wish I could just do everything in the world to go boom and just help them. You know what I mean?
Yeah.
I wish I had the means that I could take them on just to help them, right?
Yeah.
And I commend you, Walter.
Thank you.
I commend you for what you do, because you are making a difference. Believe me, if it's one person at a time.
And that's most of the time, it's just one person at a time.
That's right, one person at a time. And that is so great. We got a caller this morning. Let's see who we've got. Good morning.
Good morning, Sonshine and Walter.
Good morning, Jeff.
Jeff, how are you?
We are good. We are good. Just wanted to pop on and say, one, congratulations, Walter. Much deserved. Thank you so much for all you do. Congratulations. And Sonshine, thank you for providing a forum for stories like Walter's that are very motivating, and also not only, like you said, sharing that you've been there, but also that there is that there's a way out and there's services available. So y'all are providing a great resource to the community this morning, and just want to say thank you.
Thank you. No, Jeff, thank you in more ways than one.
Yeah, and I got to say, a lot of people don't know this, but Jeff's also involved with Emerald Coast Equality, but also Sunday's Child. And Sunday's Child, it's been 2 years ago now, provided a grant to Community Health Northwest Florida, where we were able to cover the medication costs for individuals experiencing homelessness, with a target towards our LGBTQIA community.
Right.
Because we know the health disparities that are present in the access to care issues that they have. And so that grant is still being continued today through other funding sources to ensure equity in the healthcare delivery spaces. And that's another one of, I'm a member of the LGBTQI community, and that's a passion of mine. It's identifying gaps in care and inequities and trying to address them.
Absolutely. And you see, Jeff, let me go there. Jeff, you're the bomb.
He is.
I don't know about that, but no, everybody does what they can, and y'all are certainly doing what you can this morning. And Walter, in his personal capacity, and then Community Health Northwest Florida provides such great resources to folks and really address the equity in the community. And that's why I felt like Walter was a perfect person to nominate for that award. So happy it all turned out that way, and wish y'all a very happy morning.
Thank you, Jeff, and we'll talk later.
Yeah.
Okay,
Thanks,
bye.
All right, bye-bye. And I mean, I can just sit in here. I see why it's so deserving that you did receive the award. And you were talking about a Sunday's Child. I wrote that down. What was that? Tell me about that.
So Sunday's Child is a local nonprofit. We all know about Impact 100. Well, Sunday's Child is very similar in its structure to Impact 100. They offer grants every single year to local nonprofits, and their mission is equity and inclusion, specifically. It's within our LGBTQIA community. And so that was a grant that I identified and something that could really help. And Sunday's Child continues to provide these grants year over year to nonprofits in our community to build a more equitable space within our community.
Absolutely. I've got to continually say this because I did not know all these services, and I'm just going to be as transparent as I know how. That was there offered through Community Health. And I guess, look at the light bulb, Community Health that surrounds encompasses a whole lot, and that what you do and everything that the little I think a branch that pops out from there that brings it all together is absolutely phenomenal. The things that I'm finding out today, even from a woman with a child,
Baby bucks.
I was going to say baby boomer.
They were doing some booming. They wouldn't have a baby.
You're all right with me. Even with the baby bucks, and then you got the thing with the elderly. Then you got the thing with people who are under insured. And for people who are insured, you're going to get this great service that you don't have to think just because you're coming to Community Health that it's going to be a lower grade. Is the highest that you can get. Well,
and we've actually got a new program that we're launching as we speak for justice-involved persons. So persons that are in jail. We just got selected for a pilot program grant through HRSA, which is the federal agency for healthcare. And we're going to be partnering up with the Escambia County Jail and working with individuals who are incarcerated 90 days before release, making sure that they're connected up with primary care, whether they need to manage their high blood pressure, their diabetes, if they're HIV positive and they need to get that medicine, substance use care. And so all of it, the perspective is by addressing the healthcare needs and those social drivers of health.
And that's called justice what?
For justice involves persons.
Okay, I got it.
Yeah. It's
a light bulb.
It's the new term. It always changes. We can't say somebody who's in jail.
Exactly. Let's call justice.
Yeah. But
hold on, Jeff. I'm thinking about Jeff. Hold on, Walter. What we're going to do? We're going to talk about the justice involvement once we go to break and come back. Because I want to go deeper with that because there's a lot of things that you even somewhat touched quickly that I want the community to know that is offered through Community Health. Stay close because when I say information, this is your information link right here. Sunshine's Corner with Blab TV.
You finally found the perfect car in racing blue. You even got them to throw in the LED fog lights for free. Auto Owners insures your car because some people never learn to parallel park. That's simple human sense.
Ask the Messick Insurance Agency in Pensacola if auto owners make sense for you.
Keep going. More. No, stop!
I'm Emily Echeverria, Marketing Communications Director for Council on Aging of West Florida and the host of Coming of Age. Watch our show to find out what we're doing for our seniors and their families and hear from area experts and local business owners about their programs and services. Want to help? Find out how you can work with us to bring a better future to our seniors. Watch Coming of Age, 3:30 p.m. Wednesdays, only on Blab TV.
This is Wayne at Icon Automotive in Robertsdale, Alabama, and I wanted to tell you more about our powertrain warranty forever. It comes with any vehicle we sell that has 80,000 miles or less at no additional cost to you. We put our vehicles through a tough safety and mechanical inspection before it can have the powertrain warranty forever, giving you a peace of mind with your purchase. This warranty is good anywhere in the country, and it covers 100% of parts and labor with no mileage limit, and is covered as long as you own the vehicle. Come pick out your dealership car at non-dealership pricing with the powertrain warranty forever at Icon Automotive.
Watch a new episode of Crime Stoppers Wanted Fugitives every Friday at 6 p.m. Your tips may be eligible for a cash reward, featuring items about officer training, various aspects of police work, and crime prevention information. You'll hear about upcoming family-friendly engagement events as well. Don't miss Crime Stoppers Wanted Fugitives every Friday at 6 p.m.
And welcome back to this Thursday morning edition of Sunshine's Corner. And we're talking about community health of Northwest Florida. And when I say community health of Northwest Florida, I really mean that, because it's a lot that we do. We're talking with Mr. Walter Arrington, who was the recipient of the Equity Award from Civicon here just a night or so ago. Congratulations again. And we were talking about the justice part that you're about, another branch that's going to come through with community health. Let's go back to talk about that, because we were talking about the fact how some people have this narrow mind. They may look at one thing one way when it's not that way, when they've drawn this conclusion. Let's go into that and share what we were talking about with community health.
Yeah, so, talking about narrow mind, healthcare is broad and it covers everybody, but it's not one size fits all. It's
Absolutely.
not. So we at community health, we have different cubby holes, and if you have this set of needs that may make the needs of your healthcare delivery different than the next person, we're not going to treat you the same. And it's not treating you the same from a negative standpoint, but we're going to provide additional services, additional resources, so that we can maintain health equity to bring you up with everybody else.
Absolutely.
And so one of those initiatives is this Justice Involved Persons program that's launching. And the model is we want to connect individuals that are currently incarcerated in the Escambia County Jail that are within 90 days of release with healthcare services, and start working those cases to make sure that they've got some housing when they get out, that they may have some employment opportunities, to make sure that they have a place to get their medications, whether it be for diabetes, hypertension, high blood pressure, whether they have behavioral health struggles, mental health, substance use care. And ultimately this is those additional resources to bring them up to a position of equity, across the board. But also it's going to provide better health outcomes, we believe. Data demonstrates it.
Of course.
But also recidivism. So drive down that recidivism rate and give people hope.
Absolutely.
There's nothing more discouraging to walk out of a county jail with all your life's possessions in a bag, because you've been evicted from your apartment.
You know that. That's right.
You know what I mean? Family may not have one.
Room enough to keep you.
Yeah. You've lost your job, and so trying to leverage in some of those resources so that we can provide some hope and some support while addressing those healthcare needs.
Exactly. I mean, I'm just learning so much. We got another caller.
Okay.
Good morning.
Good morning, Sunshine.
Good morning.
Good morning.
Brother Walter.
Yes, sir.
Semper Fi till you die.
Semper Fi, brother.
And PTSD, praising the Savior daily will help clear your mind field.
Amen.
And it'll adjust how your mind is feeling. To change the subject matter a little bit, the spread of venereal diseases in our community is rampant. We got gonorrhea, syphilis. Now they got so many they can't even name them. You got I can't even name them myself. Chlamydia, syphilis, all this. Are we affected in this community? I knew not too long ago that we had one of the highest rates of transmittable diseases, venereal diseases, in the state of Florida. Are we still ranked up there like that?
Yeah, unfortunately, we are. We've kind of got, I call it the trifecta. So whether it come with STIs, which is sexually transmitted infections, that's the medical term, which is your venereal diseases, HIV, so on, substance use disorder and overdoses, and then infant mortality rates. And so we do have programs at Community Health. There is not a day that goes by that we are not testing in our clinics and treating. And one of the focuses on the core program, one of the focuses with justice involves persons, our unhoused population, our unhoused service lines, our GYN clinics, our primary care is to address those infection rates. You know, you walk into our health clinics and there's a bowl of condoms sitting there. You know, no judgment, no shame. You know, we're trying to affect those rates because it's one of those things that people just don't talk about, but we've got to talk about it more.
I say it all the time. I mean, but Kingdom Walker, I did not realize that the rate of sexually transmitted diseases. I know that AIDS, of course, that's a sexually transmitted disease. And as a matter of fact, AIDS Day was what, last Sunday, I think?
Yeah, it was recently.
However, with this being transmitted like it is, how can we get the people to understand, okay, these condoms here for a reason now, and we're still at the top, so how are we going to work them to understand to use them?
Yeah, I think it's twofold. Well, there's multiple aspects. It's education, it's having the conversations, but it's also having the conversations with our youth. You know, I was recently at Northwest Florida Hoops talking to those youth, and they were kikiing and ha-haing because I had the box full of condoms, and this is how you use a condom, and this is what you do, you know, because we know kids are doing what they do, you know, but if they don't have the resources, you know, and in adults too. I mean, let's talk about Meemaw in the nursing home facility too, because we see infection.
Wait a minute.
Come on now, because Meemaw still gets down. All right, Unc with that 88 pulling up, you know, with them gator boots is taking, you know, but we got to talk about it.
Walter, I can't stop. You said, wait a minute. Kingdom Walker, I can't help it. I mean.
He hit it right on the head because there is a rampant move in the nursing homes that we have to address. These are issues, like he said, like he says, that people don't want to talk about. But it's so prevalent, and it's affecting our communities. You know, hepatitis affects the livers of people. And you got hepatitis A, B, C, D. You got genital herpes, and we also still got crabs, Sonshine. All these things
it's still there.
There was a time. There was a time here years ago. I remember they put a sign up on. It was either Interstate or Cervantes that showed a picture of a venereal disease, and they took it down because they said it was too offensive to people. But these young people need to see what happens to their bodies when they don't take care of them. And before I go, crack cocaine was heavy in the 80s, but then they learned how to cook crystal meth out in the woods in plastic bottles.
Right.
Now, fentanyl is being manufactured by different countries and sent in here because Russia said at one time if they could get one generation of America's youth, they could destroy us from the inside out. Supernatural blessings on you, Mr. Walter. Like I said, simplify till you die, brother. PTSD is praising the Savior daily.
Come on now.
Amen. Come on
Amen.
now.
God bless y'all.
Thank you. Oh, wow. You took me somewhere, Walter.
Yeah.
When you said grandma's pulling, no, with something with the gator boots, you said.
Yeah. Yeah. Unc with the Oldsmobile 88 with the gator boots. He's pulling up to the nursing home, pulling them meemaws.
Get out of here.
Yeah.
Wait a minute, we got another call. I mean, good morning.
Good morning, ma'am.
Good morning.
Good morning.
This is the one that talked to you a bunch of times.
Oh, well, good morning, my dear friend. How are you?
I'm doing fine, ma'am.
Wonderful.
I'm wanting to ask the man that's on there today if there's any way that I can call him at a local number to help me get into a living area. I rent now, and I'm handicapped. Remember me telling you?
Yes, I remember.
I only have one leg, and I'm a diabetic, and I need help getting into a facility.
Okay. ALF, like an assisted living facility?
I can't hear you.
Okay. I tell you what then. What I'm going to do then, we're going to get a phone number. I think I see your phone number on the screen here.
And so you can actually give him this number. That is my work cell. It's HIPAA secure.
I'm going to give you his cell phone number.
Okay.
Are you ready?
I'm ready.
850.
Oh, my pen. Okay. 850.
572.
572
70
25.
Yes. That's his personal cell phone number. You can call him after the show and he'll talk to you.
That's my work cell.
I mean work cell
Work
phone.
cell. That's HIPAA secured. And
That's right.
Make sure he leaves a voicemail or shoots me a text with who he is.
Exactly. So make sure
I'll do that.
Okay, thank you so much.
Thank you, sir.
Thank you, sir. Bye-bye.
Bye-bye. And you see how this show benefits, right? This is, I thank you so much that it's helping everybody, right? That's why I try to have the guest on. I appreciate you so much, sir. Thank you so much.
Bye-bye.
All right, bye-bye. And the fact of it is that it is a great mean of connection. And to find out what you have. I still can't get over Mimo. But, but when you say that venereal disease is affected in the nursing homes, are you serious?
I am dead serious. And not just that, we've got, our syphilis rates that are passing mother to baby. It's people just need to get tested. I always tell people every time I go into my primary care doctor, I'm like, run them tests.
Right.
Whether I've been or not, or whether I know my partner or not.
Exactly. Take the test.
Run those tests because there's no judgment, no shame, and there's a lot of fear. I always say one of the hardest things I do as a social worker, because when those test results come back, a lot of times those providers will call us social workers and we'll come in, we'll sit with an individual, because there's so much fear and just bad information of and shame.
Right.
Shame's powerful. And I want people to know there's no judgment, there's no shame.
Right.
If you don't know, that's even worse. Because if you know, there's amazing medications. But then also, it's stopping the spread. Until we start having these conversations, until we know, we cannot stop the spread. And I mean, with the way, let's talk about HIV. The way the medications are nowadays, people take that medication, they are undetectable. They're not supposed to, but they can have unprotected sex. And I'm not saying to do that.
We're not saying, we're just telling what the possibilities are. Right.
Yeah, the medications are amazing. And there's even prophylactics out there where, let's say you're a victim of a sexual assault, or you have an encounter with somebody and you think that they're infected. If you go see the doctor within 24 to 48 hours, they can get you a medication that can prevent infection.
What?
On the back end. Yes, they're called prophylactic medications. They can give you medications that can prevent the infections of certain sexually transmitted infections on the back end after you've already had sexual relations or sexual contact.
Did you hear that? Community health, I gotta say, let me say this. When I get to stammering like this, it's something I'm so amazed with. I did not realize the depths that community health goes in to help the community in so many areas. And that, Walter, I say, when I see it in your eyes and in your movement, the passion that you have for what you do, I know you're giving it from the heart because you want to see change in our community because it's there.
It is.
It is there.
We've got the resources. We just, no judgment, no shame.
No judgment, no shame.
Just use them. When you talk to your healthcare provider, that stuff's private.
That's right.
You know what I mean? And you're not going to surprise us. Trust me when I say we've heard it all. If we've been doing this, we're going to sit across from you and say, how can I help?
Exactly.
What can I do for you? How can I support you?
Absolutely. Ladies and gentlemen, please keep it here because we're going to come back and talk more. When we're having a conversation that's so beneficial, it seems like that clock needs to start ticking fast. You know what I'm saying? But I tell you, Walter Arrington, who is the recipient of the Equity Award from Civicon, and I see why he was chosen because of the passion and the care, the love that he has for the change that's needed right here in our community. Stay close. We've got more information for you right here on Sunshine's Corner.
Welcome to Little John's Big and Tall, where tall men and big men go for style, fit, and comfort. We offer a wide variety of styles and unique brands that service all sizes from large to 14X, as well as tall sizes from large tall to 6X tall. Our knowledgeable staff are here to make sure you have a stress-free experience and answer any of your questions. Little John's has been named Best of Pensacola and Best of the Bay for 4 years in a row. Visit Little John's at 5700 North Davis or visit us online at littlejohnsbigandtall.com.
It's time to find a health plan that can keep up with your life. A plan that makes getting care convenient, with doctors around the corner.
I can get used to that.
Plus, 24/7 access to care. Plans that keep more money in your pocket, with plan payments as low as $0.
$0.
Looks good to me.
Let's find your health solution. Speak to a dedicated Florida Blue agent today. Call 1-850-393-7036 to learn more.
Some attorney ads are really over the top, within-your-face concepts. Not this one, because there's nothing exciting about bankruptcy law. But if you're struggling with credit card debt, medical bills, student loans, repossession, or mortgage payments, you'll want to hear this. Lewis & Jernevoy has helped thousands of people with financial problems for over 20 years. We may be able to help you achieve financial freedom, and that is exciting. Call Lewis & Jernevoy today for a free consultation.
Well, I think it's all about local, and I'm a big believer in local. So I think anytime you can carry a message out locally, it's important. And I think it's anytime the person that delivers the service can also deliver the message, which is unusual. You have the people that actually deliver the project doing the talking, and I think that's a huge difference, and really makes a huge value difference for the consumer. So I'm really just so grateful that we have this local opportunity with Blab TV. My name is Quint Studer, and I am Blab TV.
And welcome back to Sunshine's Corner on this Thursday edition. Mr. Walter Arrington, and I tell you, Walter, I am so pleased that you accepted my invitation to come on the show because of the fact that I'm learning so much, and I'm finding out that community health is the place to be. Don't think that there's no places here that get you help in all aspects of life. Young, old, in the middle, whatever. I mean, Justice Department, you're helping those people. I mean, if they've been there, get incarcerated, you want to help them when they're coming back out to get back into society. Young girls who are pregnant that need help. I mean, to make sure the baby's health is okay, you offer that as well. People who are ill, who think that, okay, I don't have any means of getting help, it's all offered.
Yep.
It is it encompasses everything. So I want to have people think, get your mind out of this way of thinking, oh, I'm not going to go check out community health. Wrong answer. Because it is just like you're walking into Sacred Heart.
Just like it. And here's the other thing. If you say, look, I'm happy with my doctors, you know, I'm at this place, come use our pharmacy and let me explain why.
That's another thing that's great.
Use our pharmacies. So there's a federal program called 340B, and what 340B basically means is because we're an FQHC, we get prices lower on medications than anybody else can get in the nation.
Okay.
And with those cost savings, we're able to take those cost savings and those lower prices, and we call it the spread, you know, just like any business. And then we're able to take that spread, that difference, and put it into our other service lines and support the next person. So if you've got, you know, your insurance, your Medicare, whatever you've got, come use our pharmacies, because every prescription that you fill is helping somebody else in our community.
Exactly.
It's helping somebody who may not have money to pay full price. And so if you say, hey, you know, we talk about shop local, we're local.
That's it.
You know, I mean, you know, no shade against the Walgreens and the CVS.
That's right.
You know, they got big money, billions of dollars.
Local.
We've got 4 pharmacy locations. We've got one in Milton. We've got one on Bayou Boulevard. We've got one at Jackson Street at our main office, and then 1400 North Palafox. And again, if you're insured, pharmacy delivery. Who else is doing that?
Nobody.
And again, every prescription that you fill is helping our own community and making a difference.
That is fantastic. And you see, ladies and gentlemen, when you find knowledge is power. Knowledge is power, and we have received a lot of knowledge today with what community health offers, from CORE to Justice to the Sunday Child. I mean, just a few of the things that I'm naming off that you offer for the community that's so beneficial. And ladies and gentlemen, you don't have to go running all over town, because there are different locations everywhere that you can get the same help.
We've got I mean, look at that. That's all our locations.
Look at all these here.
All those there.
Oh my goodness. You got North Pensacola, you got Milton, you got Page, you got Central South Pensacola. There are so many. You got Jackson Street, Lakeview. Oh my goodness, 12th Avenue. Even in Cantonment.
All the way up in Century. We're all over.
All over the place. So therefore, ladies and gentlemen, there's no reason for you to say, oh my God, I can't have any help. Do that today. And please don't categorize and get that stigma. That's the word I'm looking for. that stigma out of your head that this is just a little old clinic. Wrong answer.
Yep.
This is a health facility
Yep.
that reaches out in many different aspects to help the entire family. And I mean, that is a great thing. And Walter, I tell you, the way you have expressed it to me today, I have gained so much knowledge in regards to community health. And I understand now why it's called community health, because it does exactly, it stands behind the name.
Yeah.
And with you, the passion that you have, and I know Reggie.
Yeah.
Okay.
Oh, that's my buddy.
I mean, I know Reggie, okay? And I know how he is. And with the two of you together working with this, just from the two of you that I know that it's being taken care of. And let me say to you again, congratulations.
Thank you.
Continue to do what you're doing. And this is not going to be the last time you and I get together to talk about this. I guarantee you, because there's so many things that we need to continue to talk about to make that difference. It's something you said, unless we talk about it.
Yeah.
We can't do anything about it.
Yeah.
So if a person want to get in touch with you, they can. How?
850-572-7025. That's my work cell. I always say, if you don't leave a message on my voicemail, I'm not going to call you back. Sometimes it's better to text. Hey, I'm such and such. I get back to those usually within 24 to 48 hours.
Gotcha.
Or you can just Google us, call our main line, our main number, and we'll get you plugged in where you need to be. If you've got someone who's struggling with substance use disorder that needs to get off of fentanyl, 850-477-HELP. 850-477-HELP. That's the EMS number that gets your family member, your friend,
Everything
that person you know taken care of.
Absolutely.
And then, of course, you know, we are the community. Our board of directors is made up of patients and community members.
Exactly. And Walter, I tell you, I cannot, when I say this, I mean that. Looking you in your eyes, I'm so glad that you came on with me today to share this powerful information. Ladies and gentlemen, let's make sure that if you are in need of help, community health, they're there for you. I mean, every aspect of life that you think and the quality of services, what you're seeking, they've got it there for you. I tell you, it's been a fantastic show, but I've got to get out of here. It's been a fantastic day, but I want to leave it with you as I do every day. Never, ever, ever lose your focus. Always remember, if you keep God first in your life, I guarantee you're going to be a total success. Until tomorrow at 9 o'clock, know that I love you with a perfect kind of love. Keep shining while I'm gone.
Sunshine's Corner, being brought to you by Quint and Richie Studer.